Hello friends, welcome back to our YouTube channel. Today I want to discuss with you about a very common condition. Not really a condition. I want to discuss with you about twins because I come from a region where twins are very common amongst the Bantu speaking Baganda, the Luos. Twin pregnancy, generally as a gynecologist, we consider it as an abnormal pregnancy because naturally speaking, in a normal functioning woman, you're supposed to have release one egg which is supposed to be fertilized by one sperm so that you'd be able to have one single baby. But because of many reasons, at times people who have a number who have twins. And also in clinic, I always get women asking me, "Doctor, how can I have twins?" My friend told me that gynecologists can be able to make me to have twins. So I want to discuss with you the risk factors for somebody to be able to have twins. Number one is usually age. Women of advanced age at some stage generally have potentially capable of releasing multiple eggs. And when you're able to release multiple eggs, the chances of you having twins is increased. And then family history. And that is why in most of our clinic books, we have to take history of twins in the family. And that way we'll be able to know if the patient or the mother is likely to have twins or not. And then the history of IVF, especially if the couple have conceived through assisted reproduction. In current practices of IVF, we do not encourage multiple transfers of embryo because, as I indicated to you, that multiple pregnancy per se is a high-risk pregnancy. The risks of having miscarriages are higher according to many studies. The risk of having a preterm labor are higher. The risks of having complications in the mother, things like preeclampsia, are much higher in people who have twins. So generally the current guidelines are that there should be, if the quality of embryos are okay, you just need to transfer in a single embryo and wait to see if it can be able to take up, because that is the natural way fertilization should be. So mothers who have done IVF, in some situations, because they are transferred 2 or 3 embryos, the chance of also them having multiple pregnancy is increased. Of course, there are other mothers who have been put on ovulation induction drugs. There are people who, for example, who have conditions such as polycystic ovarian syndrome, or those who have been some kind of a delayed conception. At times, doctors think it is prudent to be able to stimulate ovulation by giving them drugs such as chlomephene. Some are given letrozole, and there's a group who can also be given injections such as follicle stimulating hormone. So usually mothers who are on those kind of medicines are at a higher probability of having twins. Twins are of 2 types. We have identical twins and we have fraternal twins. Identical twins means that the babies shared the same placenta. It means that there was one single egg which is released, which is fertilized. Usually by the 3rd day, such an egg should be able to split. And when such egg splits, then you'll find that the babies really share the same placenta. They may be in different amniotic sacs or even in the same amniotic sac. So that is what usually results into what is called identical twins. In that case, most of the features in the twins are shared. They may resemble each other, the sex are the same, and all these kind of things. Meanwhile, these fraternal twins. The risk of fraternal twins are more mainly in women of advanced age, or for example in those who have IVF and this kind of thing, because now there are different eggs which are really fertilized, so the babies do not share the same characteristics like one single ovum which is fertilized. So in fraternal twins, the babies can have the same sex or may have different sexes. In most cases, they do not resemble. So that is what happens really. So as a gynecologist, we are usually a bit cautious on whether we should really give ovulation induction drugs to clients who want to have twins, because if generally there is a young woman who has normal ovulation cycle or normal menstrual cycle, and if you stimulate them, there's a risk that at times they can be able to release several eggs, and in the process they end up having at times 4, 5, 6 and these kind of things. So we always wouldn't want them to have high order multiple pregnancies. So we are a bit hesitant in most cases to be able to give them medicines to be able to do ovulation inductions. The doctors who consider that usually give extremely very low dose of ovulation induction drugs. So that's what I can tell you about how you can get twins. Basically, the issue of getting twins is genetic, and then of course others are other conditions which have related. If you've been on ovulation induction drug, if you have a family history, or if you have been undergoing through assisted reproduction. Of course, whenever I'm discussing with my clients, they also have certain myths which they discuss with me. But is it true that my friends tell me if you have this type of sex style, you'll be able to you'll be able to have twins? Is it true that if I feed on foods such as yogurt and milk and this kind of thing, I'll be able to have more? Generally speaking, having a good nutrition improves ovarian function. That is one thing patients need to know. So whether you'd be able to release multiple eggs or not is neither here nor there. Of course, culturally also people have certain herbs they take. Some of the herbs I'm not very so certain about them, but I strongly believe most of the traditional herbs which we have in our villages, some have ovulation induction potential. Unfortunately, we have not done studies on such herbs, but I know that is how some of those herbs, if at all it is true, that when their grandmothers or their village doctors gave them some herbs to take, somebody had a history of twins. Of course, some of the things are coincidental, so I wouldn't like to encourage people to be taking herbs, especially if you want to conceive, because when you take herbs early in pregnancy, at times it can also affect the development of the baby, because early in the development of the baby, usually it is the central nervous system, the heart which are developing. Those are very important organs. Once they are destroyed, they will affect the growth, and that's how some people end up with early pregnancy losses. Thank you.